On the World Diabetes Day, let me bring a perspective to the whole thing. Diabetes is a major problem not because the sugars are controlled or they are not controlled. The major problem is that if diabetes is not well controlled, it leads to multiple health issues. It leads to heart attack, it leads to kidney failures, it leads to brain stroke, it leads to blindness, and it also leads to amputation. So people lose their lower limbs because of the nerve damage. Diabetes is increasing worldwide. In India, we have over 6.5 crore people who are suffering from diabetes, and 1 in 10 child worldwide has diabetes, which is a very high number. And not only that, 30% children are pre-diabetic. So that means when these children will become adult, at least 40% of them will be diabetic, which is scary because in normal population, normal adult population, only 6 to 10% people are diabetic. So what is going to happen is when these children will become adult, the diabetic population will increase. And because of diabetes, these people die early. They have multiple health issues and then they die early. So friends, diabetes has to be looked into a complete perspective to be taken seriously. Now what has happened in last 1 year, that for diabetics, there is another treatment modality besides medicines and lifestyle changes. Surgery can help people control their diabetes for long term. They can either stop medicines completely, or even if they can't stop, they can have a controlled diabetes and they can avoid complications. So the physicians body worldwide, which includes Diabetes India and American Diabetes Association, have decided that surgery must be given as an option to all the patients who are diabetic, whether they are thin or whether they are fat. If the sugars are not well controlled, surgery should be considered. So on this day, I suggest to you to take your blood sugar seriously, to get it controlled on a regular basis, to get it checked on a regular basis. And now there are options that you don't need to have complications of diabetes. Please get blood sugar of your children also checked, and if that is high, and get their insulin level also checked, and if they are high, is a time to intervene, time to interact. Healthy living to all of you.